Good evening, everyone. Thank you for joining us. My name is Jay Williams. I have the privilege and the opportunity of serving as the president of the Hartford Foundation for Public Giving, and it is wonderful to see a number of familiar faces and some new faces. So I hope to have a chance. I was trying to make my way around the room to get to introduce myself to those of you who I have not had in my first 10 months here the opportunity to meet. So if we don't have a chance to connect this evening, I very much look forward to having a chance to connect with you in the coming weeks and months. We are absolutely honored that you are here tonight. The Latino Endowment Fund is one of the giving circles of the Hartford Foundation, of which we have a long-standing commitment, and certainly appreciate the passion, the commitment that you all have demonstrated to this community. Our giving circles matter because they allow us to work with our donors, work with community stakeholders, to work with them to highlight issues of importance and priority within the community, and then figure out how to direct those resources from the donors and the participants of the giving circles themselves, resources that we have at the foundation to address those issues. And we take very seriously our role as a community foundation of the 29-town Greater Hartford region, the capital region, and bringing together not just the financial resources, but the convening power of the foundation, the thought leadership, the research, and all of the other things that we have an obligation and are honored and privileged to bring to this community. We're here because we know that it was almost a year ago that the Caribbean was hit by hurricane season that was unprecedented in its devastation to the Caribbean islands, Puerto Rico, and the U.S. Virgin Islands. And just today or yesterday, I'm sure many of you saw that the studies that were done regarding the actual death toll, not the official death toll as reported by the federal statistics, but it is estimated that in this, conservatively, that 5,000 individuals passed away as a direct result of the storms, and then the days and the weeks thereafter where individuals did not have access to some of the basic human needs, the suffering that was going on. And it boggles the imagination that the United States of America, and purported to be the most developed and advanced economy and nation, and we talk about our humanity, that 5,000 U.S. citizens perished, even after the lessons learned of Katrina and so many other disasters. In addition to that, in the article I saw earlier today, that the island of Puerto Rico is still, some estimates 2 months away from full power being restored. With the start of hurricane season tomorrow, or within the next day or so. So 8 months after those devastating storms, that there are still 2 months away from full power restoration, and even that is a best case scenario. You all know, and as my family and I have been here for now almost a year, that after those storms, the Greater Hartford region has maintained a special relationship with the Caribbean and Puerto Rico in particular. A large number of residents call this region home, and there is ongoing commerce and travel and cultural enrichment that happens between this region and the island. And as a result of those devastating storms, the Greater Hartford region became a natural refuge for those individuals and those families that were escaping the devastation of those storms. And when they arrived, those individuals and families became a part of this community. They were welcomed with open arms. Those who had direct and immediate familial connections, and those that still found their way here, were welcomed by residents and stakeholders of this community. As a community foundation, we are your community foundation, and we understand that we have an obligation to act, an obligation to be proactive, but also to be responsive to the needs of the community. And as a result of this, the Hartford Foundation created our Respond, Rebuild, and Renew Fund. And we were very deliberate in using those words to describe this fund. The importance of responding with a sense of urgency and immediacy to the issues as they were affecting and impacting residents within this community, but the connections that we had in this community to those impacted by the storms. Rebuilding, understanding that rebuilding doesn't always happen immediately. It is a process that takes time. And it's not just about rebuilding homes and infrastructure, it's about rebuilding lives and rebuilding families and rebuilding those relationships. And then the renewal part of that, renewing the trust and the bond and the commitment that we have to our fellow citizens. So we created that fund as we had been talking about it, but that just was an unfortunate event that ultimately precipitated that. But the creation of that fund, and we have been humbled by the response from the community since that fund has been created last fall. More than $230,000 has been awarded to agencies for direct services and supports and for case crisis management. In addition, we have commissioned a needs assessment survey, and we appreciate Dr. Santiago and his skill in helping us with that. And you'll hear about that this evening. That's helping to provide data for the needs of this region as it relates to those who have been impacted by Hurricanes Irma and Maria. Specifically, just to give you a couple of highlights. $200,000 was provided in February of this year to the United Way of Central and Northeastern Connecticut for shelter, diversion, emergency assistance, and disaster care management. $30,000 in February 2018 was provided to a collaboration between the CREC Relief Center, the Salvation Army, and Catholic Charities. That money was used to provide direct services and supports. Our donor advised funds, again, our donors are why we exist. The essence of our ability to do anything is directly related to our donors. They provided nearly $20,000 to the CREC Relief Center for direct services and supports. And in November of 2017, almost $50,000 to the El Institute at UConn and El Central at City University of New York and Hunter College survey for the surveys on the hurricanes Irma and Maria and the impact that they've had on our region. So the foundation has got long-standing investments in direct services for basic human needs, food, housing, healthcare, in addition to our broad-based support in the priority areas of education, family economic security, and vibrant communities. And this helps address those intersecting and complex challenges faced by those who are seeking refuge in our community. It's an issue that's of importance to us. It's an issue, obviously, that is important to everyone here, and that's why we appreciate and seek to collaborate and provide a platform anytime that it would be important to members of this community, our stakeholders, to ensure that we address these. And also, it's a learning experience. One of the things, as I close, I would bring your attention to is that within the material you have, there's a card with 4 questions. Each of these events provides us an opportunity to learn, to be better, to be more proactive, to be more responsive, to be more informed of how we work with the community to address the issues that are immediately before us and those issues that we may not be aware of. So if you wouldn't mind of taking the time, and you can fill the cards out here or it's prepaid postage, take them home and just give some thought to some of these questions. And the questions that are being asked are helping us to inform our next strategic plan. We're in the 3rd and final year of our current strategic plan, and as we formulate the framework for our next strategic plan, it is essential that we have feedback and perspective from residents, a broad and diverse array of residents from across this community. So by doing that, your voice, your perspective will help to frame our next strategic plan to ensure that we continue to be responsive to the needs of the community. We're using a lot of data sources, various indicators from across the community, but nothing is more important to us than ensuring that we have a direct line of communication and an ongoing line of communication between those stakeholders, residents, citizens, donors, people who just may not be familiar with the foundation but are absolutely passionate about the quality of life in the community, the well-being of their fellow residents. So again, thank you all for joining us. I am pleased to be in this beautiful venue. This is my first time in this venue. I was commenting that, what a wonderful place that is a hub of nonprofit activity, pleased that we can be here in this neighborhood supporting that, and I very much look forward to future opportunities to engage. Thank you in advance to the panelists. I'm looking forward to hearing the panelists. I have another dinner that I'm pushing back a little bit later this evening so I can partake of some of the wisdom, knowledge, and discussion of the panelists, and we appreciate all of you being here. And that being the case, I'm going to turn this over into one of the members of the Latino Endowment Fund, Evelyn Lafontaine. So thank you all very much for joining us. I give you Evelyn.
Buenas tardes. Good to see you all. It's wonderful to see so many of you here, friends and acquaintances and people that have worked so hard for the community and worked so hard for the Latino Endowment Fund. I'm pinch hitting tonight because Moraima Gutierrez couldn't be here, unfortunately. She had a family commitment and couldn't make it. So I'm going to be as brief as I can and not delay the presentation as I can. I have been a member of the Latino Endowment Fund for a long time, at least 10 years. And it's been very, very rewarding for me to be part of this organization and to be a member of the steering committee, because this is an organization that is really, really important. We do things quietly, but we do things well, and we do things in a very strong and committed way. So as a member of the Latino Endowment Fund, I urge you all, if you are not yet a member, to become a member, because what we do is so significant in terms of the Latino community, and we need as many supporters as possible. It's been 15 years since the start of the Latino Endowment Fund. In fact, I believe this month is the anniversary of the fund. And the fund was established really to promote philanthropy in and for the Latino community. The mission is really to advance social, economic, educational, leadership development in our community. And that is so critical, so important. We have, during this time, during the 15 years, done a lot in terms of helping nonprofits and giving grants each year. We provide a grant each year of $20,000, and over the years we have provided almost more than $200,000 in grants to nonprofit institutions that help the Latino community. We also have, over the years, had similar presentations as this one this evening, similar panels, discussions on education, on leadership, etc. As I say, we do our work quietly, but we are steady. We are steady. It's very significant that we are here tonight because we know the devastation that went on in Puerto Rico and the Virgin Islands. Many of you have families that have been affected by this, have been back to the island to see family, mothers, brothers, uncles. In my family, we had uncles and nieces that lived on the island. We couldn't communicate with them for days and days and days, didn't know what was going on. So you understand, I don't have to tell you how devastating it was. So this evening, we thought it would be really important for us to get together to see what we can do, what we have accomplished, because you know that in the aftermath of this hurricane, many Puerto Ricans came here to the Hartford area, to New York, to Boston, etc., needing so much help. And we responded. This community responded and worked collaboratively to help and to do many things that would make the life of these individuals better and safer. So tonight, we have the privilege of learning more about what went on, how these organizations collaborated to help, and we really are looking forward to hearing more about it and also to see what we can do in the future to continue this work. So thank you very much. I appreciate your being here. And I introduce Wanda.
Buenas tardes, again. And my name is Wanda Correa, and I'm Senior Development Officer at the Hartford Foundation for Public Giving, and I am thrilled to see all of you. As Evelyn said, lots of familiar faces, new faces, but certainly a great reflection of the commitment in our community to doing good. So I'm your moderator for this evening, and I wanted to take the time to kind of give you a roadmap of what we could all expect tonight. There's a lot of great information that you all will hear, and I want to make sure that we give each other the opportunity to get that information to all of you. So the first thing I want to say is this is a program that is not going to take a break. Now, I know for some of you after that food, that may be a little bit of a problem, but I would tell you we are going to allow you to take your own self breaks as you need it. We have restrooms on this corner, some of them on the side of the stairs here. There is still food and water and coffee, so make yourself available to all of those things as you need it. We do have 4 panelists, and we are extremely grateful to having them here with us this evening. We will have them present and go through all of their presentations, and at that point we will take questions from all of you. What we ask is that you write your questions down. We have pads and pens at the table. Make sure to write your questions down and to hold your questions until the end. We promise we will try to get to everyone. I know this issue is of importance, and this is going to be an opportunity for not only for you to learn from the panelists, but from also to have all of you perhaps impart some knowledge to the panelists. I can tell you, as Jay indicated, and I will let you know this piece, as a staffer at the Hartford Foundation, we are here as well to learn, and we want to utilize this opportunity to better inform our continued work in this area. And I am not here alone as a staffer. I have several other colleagues who are here. So I did want to let you know that we are also using this as a learning opportunity. How we're going to do this. So each panelist I have tortured, I have to tell you, because each one of them in their own very respectful way has told me it's very hard to talk about this in 15 minutes each, Wanda. So what we're going to do is, with the assistance of my colleague Isaiah Torres, we are going to set a little timer, and we're going to do a little gentle reminder when they've got 5 minutes left, and then we'll do another reminder when the time is up. And what I've told them is what I will tell you, is that, always in a presentation we cannot get to everything, but oftentimes what happens is, and the beauty of opening this up to questions is that when you ask a question and it prompts the response of, oh yeah, I forgot to mention that. So I wanted to make sure to kind of say what we needed to say on that end. So that's what I have for this evening. Again, we're going to go straight through, and I look forward to having our panelists begin. And with that, I'm going to start with our first panelist. So this evening, we are very fortunate to have with us Dr. Charles Venator Santiago. Charles is a professor at the University of Connecticut at El Instituto, a joint program with El Instituto, which is the Institute for Latin American and Caribbean Studies, and also political science. He is the lead investigator, principal investigator for the Hartford Foundation survey that Jay mentioned with regards to the needs assessment to find out what it is that's going on. Charles is going to talk to us about some of the preliminary findings that he has found, and I'll turn this over to Charles. Thank you.
Oh, I was gonna use my watch, and then I'll sit with you, and then.
Okay.
Instead of interrupting.
Okay.
That good? That good? This is your ring. Here, you use the
Thank you. Thank you to all for having me here. The last time I was here was at the behest of Estela, Pirosa, and Luis Caban, a long time ago, talking about another survey on politics. So I'm excited to be here again. I also want to thank especially the Hartford Foundation for being patient with me, because the survey itself has taken a lot longer than we anticipated for a lot of reasons, including weather. But we're excited about what we're finding and what what we've done with the survey. We just recently finished a survey. So we're in the process of codifying data, of making sense of all the information that we have. What I want to do today is briefly go over 4 points to give you a general understanding of what we're sort of working with and what I think you should think about. All of you have a copy, or should have a copy, of the detailed presentation. I promise to edit it a little bit more so it can be published in the Latino Endowment front page with my contact information and a little bit more information in case you want to send me questions or in case you have concerns. These are really important because the goal is to produce a final report in the next 3 weeks or 2 weeks. So the idea is that we can incorporate whatever concerns, questions, interests you have into this final report that we're going to give to the Hartford Foundation for Public Giving. We have a ton of information, more than we can use for a report, so we'd love to incorporate your thoughts. Okay, so part of what I want to do is give you a sort of big picture on the migration of Puerto Ricans to Connecticut after the hurricane, give you just a brief mention on the policy debates, and then talk a little bit about the survey. Okay, so the question is, how many Puerto Ricans came to Hartford after the hurricane, or to Connecticut after the hurricane? And the simple answer is we don't really know. And that's a problem for lots of reasons that'll make sense in a little bit. The best estimate that we have is coming from Incentro, and I'll give you a sense in a second. But it's a sort of calculation based on estimates from U.S. Census Bureau data and education enrollment data available here in the state. Connecticut, some state agencies have been collecting information, and they have one number that is, we believe, significantly lower, but it's the number that they have based on registrations. We can't expect more to the extent that a lot of people are coming here and they're not necessarily registering with state agencies. In addition to that, there is some information available that we're trying to sort of get a hold of, but as an academic, I don't necessarily have access, which is aviation data, which means how many people bought or purchased tickets to arrive here. The problem with that, as I can tell you personally, is that a lot of people arrive to Connecticut via different mechanisms. So for example, I had to pick up my mother 2 weeks after the hurricane in New Jersey because she couldn't arrive in Connecticut, and we drove from New York to here. And in the New York airport, we met a lot of people who are coming to Bridgeport, New Britain, Hartford, etc. There is another source of data that we're trying to sort of figure out, which is U.S. Postal Service data, or put differently, mailing address. If people relocate here, they sign up to change their address. And then CityLab, for those of you who've sort of read the recent report, collected some data based on cell phone usage. People brought their cell phones, they used it here, and they were able to track. I'm in a personal conversation with the U.S. Census Bureau, and hopefully tomorrow we'll resolve this. But part of the challenge is that the data that they have is based on last year's data. They don't necessarily collect data for this year. But we're having a conversation. So hopefully we'll have some accessible data soon. Okay, so the best estimate that we have so far, if you look at this table, and this is a table produced by the Center for Puerto Rican Studies, which is the partner that we've been working, as Wanda Correa suggested, is that 13,292 people came to Connecticut within the first 6 months of the hurricane. In other words, between September and February, we had about 13,000 people arriving in Connecticut. And that data is calculated based on American Community Survey data and statistical averaging over the past 3 years and education enrollment. We are also finding that a lot of people came to Connecticut and already left. So I want to contextualize that, because that number may be a bit inflated to the extent that some people have already returned. But that number is really important because, as we found in the survey, and we'll give you more information in a minute, a lot of people now have created couches and beds in the state of Connecticut that will receive future people maybe as soon as next month. Okay, some of the basic data that we have is that from the state, FEMA has logged 1,229 households, or registered 1,229 households, and 2,830 people. 88 families are currently staying in 20 hotels throughout the state. And this is based on Governor Malloy's hotel evacuee hurricane support planning group situation report. And this is a biweekly summary summary that gives you a sense of what the agencies are sort of negotiating. You can see upwards of 1,783 students enrolled in public schools in the Hartford, or in the state of Connecticut, rather. And the Department of Social Services is working with 962 single adults and 814 families. This is the data that's available through the state. Okay, in terms of policy, part of the challenge is that, unlike prior hurricane events, there was no agreement between the federal government and the state of Connecticut. FEMA brought people here and managed the situation here. A lot of Puerto Ricans who came here came fleeing from a hurricane that happened in Puerto Rico. So the policy debates around the response in some ways are tempered by the fact that the hurricane or the crisis happened in Puerto Rico, not in Connecticut. And in some ways, the response has to be understood as an effort by Connecticut to address a situation that happened elsewhere, but with repercussions in the state. Until recently, FEMA controlled most of the funding. The state legislature, as of May 9th, approved a budget, I believe is close to $1.5 million to start addressing some of the situation in the state. For the most part, we don't really have, how should I say, a federal response to the crisis in Puerto Rico. To give you one brief example, in the events of Hurricane Katrina and Sandy, Congress enacted something called Disaster Housing Assistance Program, which provided support. This year, for this response, FEMA activated the Small Business Administration loan system. So people who have nothing are asked to take on loans so that they can figure out how to survive in this crisis, unlike prior events. But there are efforts by Senator Blumenthal, as I've been informed, to see if they can get some federal funding to provide disaster housing assistance program. The point is that we're dealing with a situation in lots of vacuums. Nonprofits here in Connecticut have assumed the bulk of the responsibility with limited resources, and hopefully now that there's some federal, some state money, maybe something will happen, but it's not clear how that state money is going to be allocated. Okay, so that's a little bit of the background. Let me give you a little bit of the grant, which is in the survey. We were approached, El Instituto was approached by El Centro as a result of a Hartford Public Grant, Hartford Foundation for Public Giving release of a grant to assess the needs of the situation back in October here in the greater Hartford region. And I said, sure, Edwin Melendez at Centro, whatever you need, we'll do it. I didn't realize what we were doing at the time because usually surveys are conducted by phone, and usually there are simpler ways of conducting surveys. Edwin wanted me to go in the streets and talk to people in cold weather and try interviewing 1,000 people in the cold weather and say, listen, you know, I'm going to give you $10, and people are like, it's too cold to top them. But, you know, by the time we had enough publicity, people were coming up to us and saying, hey, I heard you had $10. And don't I know you? Oh, that was my cousin, or my twin brother is one we heard a lot. That was my twin brother in New Britain. And I'm like, no. But anyway, we managed, we had a team of really interesting students, and we managed to interview upwards of 1,300 people, which is a statistical sort of, it's about 1% of the greater Hartford region population, which is statistically significant. And we targeted all the zip codes in the greater Hartford region. Okay. We were looking for basic demographic information and to do a needs assessment of what's happening right now and what's happening in the future. In other words, what to expect. So let me give you some of the basic findings. One of the challenges that we had is we used census income categories, but as we found out when we looked at Connecticut HUD rental income categories, the median income for a resident of Connecticut is $95,000. And I'm like, what Puerto Rican is making $95,000? I mean, there are Puerto Ricans who are wealthy enough or are making that money, but the majority of Puerto Ricans are not. In other words, if you look at this upper number, based on HUD categories for Connecticut, 71% of the people who responded to the survey are considered to be living in extremely low or have extremely low income or living in poverty. Most of the people that we talked about were earning or living in the greater Hartford region with less than $15,000 a year. And these are families that we're talking about, families of 4 people or more. As you can see, the majority of people that we looked at were earning less than $71,000, actually less than $48,000 a year. Okay, one of the questions that we asked is there someone staying with you, including yourself, because they were displaced by Hurricane Maria? And 72% of the population, or the majority, almost two-thirds or three-quarters of the population said no. But they qualified that no. They said no, they came and they already left. So based on the survey, we were interviewing about a quarter of the Puerto Rican population that still has people living here in Hartford. Almost two-thirds of the population, as I mentioned earlier, that is receiving or hosting people today are living in have extremely low income, or living in very low income or low income, are living in poverty in the state of Connecticut. One of the things that we're finding is that working class people or working class Puerto Ricans in the greater Hartford region are assuming the greatest burden in hosting Puerto Rican migrants. That surprises us a little bit. In one sense. In another sense, it confirms what we already knew, that the Puerto Rican population in Connecticut is living at the edge of poverty or in poverty. I shouldn't say the Puerto Rican. A majority of the Puerto Rican population is living in poverty. So what we're seeing is also confirming what we already knew based on census data. Okay, what are the current needs of displaced persons? And forgive me for rushing, but I'm trying to cover a lot of material. When we were looking at these questions, a lot of folks asked whether we should divide the information based on gender. And I objected. I said, well, everybody's giving us the same answers. Why should we make an issue around gender? And I was wrong. 60% of the people who answered the survey were women, and 40% were men. However, and this is not necessarily reflected in the data, in this particular data, because we're still working, we found some significant differences in the data for women and the data for men on needs. What we generally found for women is that the top priority is housing. Most women told us, right now we need more housing, we need better housing, and we're also hungry. We don't have enough food. People who are employed and working do not earn enough to sustain the amount of people that are living with them right now in their homes. People are going hungry, even though they're employed. We also found that employment is a big need for women, more than men, and I'll explain that later. Women are more likely to look for jobs, or are looking for jobs right now, and then healthcare. Those are the four big needs that the Puerto Rican population who is hosting, or the households who are hosting Puerto Ricans who have been displaced by the hurricane, are facing right now, according to women. In the case of men, again, similar, but we have the question of housing and food. Those are the two top needs, and at that point, things get vary a little bit. Healthcare is a third top need. But then the question of employment is a little bit lower than the question, and it's not reflected in this data right now, of social services. A lot of men reported that they were more interested in finding social services to substantiate their, or to survive in Connecticut. However, the point that I want to emphasize again is that the two top needs are housing, or need for housing, need for larger spaces or more space, food, and then healthcare. Okay, on the question of current needs by income, again, working class Puerto Ricans or people living in poverty are telling us housing, food, employment, and healthcare. Lots of Puerto Ricans, almost two-thirds of those who we interviewed, are telling us unequivocally we need better housing, more space, food. We don't have enough to eat. We can't feed our families. We can't feed our children. Okay, so that was an assessment of the current situation. That assessment, I want to qualify it, is really important because it tells us how many people are here dealing with that situation right now. And for us, it's really important because we've been calculating mobility of people around the school year. A lot of parents are making decisions on whether to return or go back to Puerto Rico based on the school calendar. The question is, what happens next? What can we anticipate? 92% of respondents told us we have relatives in Puerto Rico. In other words, the majority of people that we interviewed are telling us we have someone in Puerto Rico, and they're telling us we may expect somebody to come here. And that expectation is going to vary. Again, more than 50% of the population, or the people who participated in the survey, told us that it was very likely or somewhat likely that someone from Puerto Rico would be arriving here, either after hurricane season, after the school term, or as a result of the economy in Puerto Rico. Okay, what are the anticipated needs for people who are coming to Puerto Rico who are coming to Connecticut as a result of the crisis in Puerto Rico? Housing, food, employment, and healthcare. Unequivocally, women are telling us if someone's coming from Puerto Rico, they're going to need either more housing general period, or a room. Yes. I'm almost done. And food. Men are telling us almost the same thing. Housing, food, employment, and healthcare. We have more data that sort of confirms a little bit more around the question of social needs or welfare needs. I do want to emphasize a little bit more this question of education and childcare. Women are very clear that they're looking for education and childcare, whereas men are less likely to talk about education and childcare for their children. One of the things that we are finding is that a lot of single women are coming here and they're bearing the brunt of the children, or a lot of women are coming here while their husbands are staying or the spouses are staying in Puerto Rico. And women are more likely to think about the long view when thinking about children. Now, I want to qualify this because we were trying to get at the question of LGBT, or lesbian, gay, bisexual, and transgender migrants, and we found this unequivocally that lesbian women were also telling us that we are interested in employment because we're assuming responsibility over families, our mothers, our sisters, or other relatives. So I don't want to sexualize gender, if I express that correctly, but we do find a general difference between women respondents and men. Needs by income, again, we're still talking about housing, food, healthcare, and employment. Okay, let me stop there. I think I made it within my 17 minutes. I have a ton more information that I can qualify and clarify and expand on, but I'll wait till my turn. Thank you.
Gracias, Charles. And I just want to let my panelists know that I will let you know, so it's okay. I don't want to put you that stress, especially since you have lots of good information coming along. Isaiah and I will work to be gentle with the reminders. Yeah. All right, next, our panelist is Dr. Leslie Torres Rodriguez. She is a superintendent of Hartford Public Schools. Dr. Torres Rodriguez, thank you.
Good evening. So yes, as a superintendent, I am going to bring the educator lens. And so there are times in which I'm going to use certain words that I'm going to be intentional around explaining what that means, just in case not all of us are educators here. I also wanted to start with actually some data points that are part of the appendix, but I think it warrants an opportunity for us to just ground ourselves in my presentation around who it is that we served and are currently serving in our schools as a result of the crisis in Puerto Rico. And so I'll just let you kind of look through these data points, and I'll speak to some of them. 459 total students we proudly enrolled in our district. You know, I was very intentional. It was important to us at the district level to uphold our statutory and our moral responsibility to educate our students in the best way possible. And so that's how we entered into this work with our students. As you can see here, we have students mostly in the schools that are listed here, but we have students in 26 of the 46 schools in our district. Primarily, our students are enrolled in South Hartford, and so 75% of the total students that we received are in schools in the south of Hartford. And initially, we identified 4 schools that we knew had already programs that would provide not only bilingual but bicultural services to our students. And quickly, quickly we learned that we wouldn't be able to service the students because of the amount of students and families that were coming and enrolling. When I disaggregate the data further, because it clearly has implications for us in programming now and moving forward, we know that 40% of the students are in pre-K through grade 3. 40% of our students. And so when we think about building a foundation around literacy, that's an important data set for us. On the other end of the continuum, we also know that 26% of the students that we have are high schoolers. So we have to think about the other end of the continuum and how to plan for them. So my presentation is actually going to focus on 3 themes, 3 areas, because we felt that we had to, in order to meet the needs of our students, we had to accomplish and program in 3 different ways: academic programming and enrichment, family and community engagement, and college and career planning. As it relates to our academic and programming enrichment, we had to have an individualized approach to our programming for all of our students. And so we have what we call English learner coaches at the district level and throughout some of our schools. And so it meant that as families were coming in, we were working very intentional with each family and each student around transcripts, identifying what courses they had taken on the island. We still, by the way, have students in which we've not been able to secure their transcripts, which means that we have to take a very individualized, student-centered approach to the work so that we can allow our students to show mastery in very different ways. We certainly do not want to penalize any of our students because we don't have a transcript and we're not able to identify what grades they have been awarded back home in Puerto Rico. We had to reallocate. We reallocated staff. It wasn't pleasant at first for some schools that were losing their certified staff, but we had to identify where the staff were and reallocate to where the need was at that immediate moment. And so again, urgently, intentionally, fast response to meet the needs throughout the district. We had to hire 15 tutors to support students throughout our schools, many which, by the way, were retired teachers in Hartford who jumped at the opportunity because of their connection, not only to the district, but to the Puerto Rican community in Hartford. And I'm happy to say that many of the students have joined our sports teams. They're participating in our activities. They have, they're honor roll, high honor roll students, and so they've become part of our larger community. Family and community engagement was key to our approach as well. As a community, I learned that we at Hartford Public Schools have an understanding of the Puerto Rican experience from a learner perspective, which helped create a welcoming environment, not only for the students, but for our families. We have family resource aides. These are the staff that on a daily basis interact with our families in all of our schools. And so whether it was from uniform support, accessing community resources, organizing special events, providing resources that were, in Spanish. This is what immediately took place when all of our students were coming through our doors. And we were able to leverage a lot of the resources through the partnerships that we had, whether it was with our city officials, our elected officials, our community-based providers. Everyone collectively galvanized around this one goal that we had, which was to not only welcome, but program accordingly for our families. College and career planning was also important to us, knowing that many of our families had communicated earlier on that they were going to be with us for the remainder of the year and even into next year. I have one data point. Of those 459 families that we enrolled, 371 students are still with us. And so we know, and by the way, we've heard what Charles shared with us. Many have told us that they will have family members that will be joining over the summer. and they'll be enrolling in our school district. And so we anticipate that the enrollment will continue to go up. In terms of the college and career planning, we did establish a partnership specifically with Central Connecticut State University, given that the university had already identified an AirBridge program. And so, it became an opportunity for us to leverage the students that they had enrolled to become mentors and tutors for our students, and to create an opportunity for our students to this summer have seamless access to higher education opportunities. And it's something that we certainly are going to continue to do for our juniors, our rising seniors for next year. In terms of what we learned, as I think about it from a system level perspective, clearly it was an urgent, it was an immediate and very organized response from the district. We were proactive, we mobilized really fast, actually within days of the crisis. And we learned that we had a strong foundation, an academic foundation of programming already in place. So there was already a blueprint. It was just a matter of expanding based on the need. And we also learned what I call, there's altruism in our blood. And I'll say that from the district perspective, but clearly that extends throughout the city. We have an immense capacity for an altruistic response with a collaborative approach to our work. And not only am I proud of as an organization and the way we were able to organize and respond to the challenge, but for our staff, primarily for the schools that had the highest number of students that were English learners and needed the bilingual instruction to occur immediately. And also to the schools that were losing their staff because we had identified a need elsewhere. The greatest difficulty, and we still have it, by the way, was finding certified staff to fill the positions that we needed to provide the appropriate instructional support. We still, by the way, have 8 vacancies. 3 are pending certification. Those 3 actually were displaced teachers in Puerto Rico who were immediately employed at Hartford Public Schools and are now going through the certification process. But still, we have 8 vacancies, and we're working hard and trying to connect with folks in Puerto Rico for an additional staffing needs that we have. One learning for us was around evaluating transcripts for our students. We wanted to provide a differentiated approach to placing students, but we learned that some of our students who were special education students, it was very hard for us to initially be able to interpret some of the individualized education plans. And those are added resources that we often don't think about when we immediately just assume that it's just teacher support that is needed. Right? It's beyond those. And so the transcript evaluation piece was a challenge for us. But despite all of these challenges and the amount of response that we had to do immediately, I'll tell you that our staff worked tirelessly to identify the needs, and then we could not have done it without our folks, at the city and other community-based organizations helping our families with the other needs, right? The housing needs, the medical needs that are needed, right? We knew that sometimes we do that at the school level, but because of the amount of students that we had to address, it was helpful to us at the school to know that there were others in the community that were meeting those needs of our families. Something else that I have here, when you see there, understand the Puerto Rican journey, it's something that we learned. En las escuelas públicas de Hartford entendemos la jornada puertorriqueña, right? We really understand the Puerto Rican experience, and whether it is through the learner lens, because several of us are deeply and personally connected to that experience, that experience of a family having to migrate to Hartford and having to transition as an English learner, but many of our adults and our staff over the years have had a personal connection to the Puerto Rican experience as well, because of friendships, but also because they've taught our students and their families over the years. And so it was really validating for us to know that we understand that and know that we know how to service our families. It's a matter of resources. Having resources to provide those services at scale throughout our schools. And so it really wasn't a surprise that we took a very humanistic approach to this work. And so it's now identifying resources to sustain. Which brings me to what still needs to be done for our students. And so we look forward to the summer, and we've already started conversations. I know that Wildalis and I started the conversations around, well, how is it that we're going to program to be able to sustain the supports for our families and for the students. And so, making sure that we identify how to get our families involved in what we call Early Start. That's our summer program. In Hartford Public Schools, we don't have resources to provide summer school for all of our students. So years ago, Hartford Public Schools does not have resources to provide summer school for all of our students. And we know that when our students have learning gaps, the summer months are so important, right? Because we don't want our students to regress in terms of their learning. And so we provide early start, early summer programming for students in our lower grades. Well, we know that we don't just have students that came from Puerto Rico in the lower grades. We have them throughout the entire continuum, in addition to all of the other students that we already have, right, in Hartford Public Schools. And so we're trying to identify how to meet the needs of our students at those lower grades, but also we don't want to leave all the other students in the other grades without having access to programming. We want to make sure that we have supports, bilingual teachers in our summer program for our students. And so we are also identifying ways to recruit staff for the summertime. Our Welcome Center is exploring methods to, as we look at next year and potential additional enrollment throughout the summer, ways that we can assess our students immediately when they come to us. All of the students that come to us require that we do an English language assessment. And so, we weren't able to do that immediately. And so there was a lag sometimes of several weeks before we could identify the true services and programs that our students needed. We now are in a better place to make those assessments earlier on, but that again requires additional resources. And so clearly we know that many of our families have said we're staying, and so we have to now be strategic in how we can leverage the supports to provide for the 8 weeks, right, of the summer, and then again ensure a smooth transition for the next year ahead. In terms of wrapping up, when I kind of take a step back and assess the adversity that we all know our families faced and had to overcome, and I heard earlier Charles talk about the migrant experience. We've welcomed the students, but also as a community, right? Everyone has stepped up to that, and so I see it as a potential blueprint for how we can address other needs that we have as a larger community. And so we had one goal, and I think we all shared the goal, right, which was to meet the needs. And so we rallied around it. And so, while they're not here, I do want to take an opportunity to just highlight all of our staff, our teachers, and our administrators for their approach to the work, and knowing that it was a challenge, but it was a beautiful opportunity that was in front of us, not only to validate the fact that we know how to serve our students, and that we have an understanding of the power of partnerships and collaboration moving forward. So thank you all, and thank you all that are here that were partners in that work and allowing us to serve our families and serve them well.
Thank you, Leslie. Next, we're going to hear from Aura Alvarado. Aura is the Director of Communications and Community Relations at the Capital Region Education Council and was instrumental in developing the Relief Center for our region. Aura.
Buenas noches. Lots of friendly faces and new faces, so I'm excited about this opportunity. So some of you heard about the Centro de Ayuda, the relief center for our Caribbean friends. How did, there's many stories on how we opened this center, and so the first thing, really, the hurricane hit in September. It just happened to be that the CREC leadership team was doing their first day of service in the greater Hartford area. There was about 50 of us, and we were broken up into groups of 10, and we all picked different projects. And we ended with a lunch, and the hurricane was around, it had just hit. So you could imagine how we were all feeling. We were just helping our community, and the hurricane, and for me personally, a lot of people at CREC, we have family in Puerto Rico. We were devastated. We didn't know what to do. So from this leadership service day, this idea came. And in October, our CFO, Sandy Crucerano, we invited, I think the list was over 100. We had, in less than 3 days, 70 people showed up to just hear our idea. I'm sure a lot of people came and was like, what's CREC up to now? But it was okay. We just wanted them to know what we were doing. And 3 meetings, I'd say 2 or 3 meetings, we said, we're not here to debate this. Whoever's on board, join us. This is what we're doing. And lo and behold, November 1st, we opened our doors with the center. We were also hoping that somebody would say, hey, we want to come and be your fiscal agent. That didn't happen. That's okay, we had it covered. We had to keep moving. We couldn't wait. So thankfully the CREC Foundation, which a lot of people don't know about, but we have a foundation, and 100% comes in, 100% goes out. CREC absorbs all the administration fees for the foundation, so that kind of gives us a little more leeway to do more. And the volunteer and the donation network was up and running as soon as we opened the doors. So, who was served? Around 2,612 displaced families. Those are individuals. So in terms of family, that equals about 658. And still counting, because people are still calling us thinking we're open. On-site access, one-stop shop. One-stop shops, one-stop places are not something new. We've done it in the past, right? I remember the one-stop centers we used to have. That's what we did. Bilingual case managers as much as we could. Staff were always on hand. We had transportation to and from. People were coming here from Puerto Rico. They did not know how to navigate our bus system. They had no car, and it was pretty cold, right? So we provided that. And in 5-6 months, we raised over $150,000. Private money, help with the Hartford Foundation that gave us 10. So it was just coming. People just, it was from every side you can think of. It was a beautiful thing to watch, but it was also a very humbling experience. What was accomplished? As an internal agency, collective impact. That's sort of like collaboration, but really making it work. Because we talk about collaboration around the table together, and then we turn around, and you know what happens after that. We have the conversations in the hallways, in the bathrooms about, ay, nena, por favor, yo no voy a hacer eso. Okay, right? I'm sorry, this is me. Agencies accepted the call to address the needs right away. Again, those 3 meetings, this is what we wanted to do, this is what we can offer, what can you offer back? That's all it's about. Collective impact is what can you give us? This was temporary, so what can we do in the immediate call to action for these families, and that's what we did. We have FEMA on site, we have workforce readiness with Capital Workforce, healthcare resources, mental information, Catholic Charities, rental deposit assistance and other services with the money we were collecting, and with the other agencies that came on board, like Salvation Army, Food Share, Sanitas Medical, everybody was coming in right at the end. And municipal and state IDs, obviously our folks were coming, and our license from Puerto Rico works here, right? But only for 30 days or something like that. But people were being turned away because they did not have an ID or a Connecticut license. That just boggles my mind sometimes. But so we were helping people get that turned around pretty quickly. The biggest thing, the grassroots navigators, people like you in the room, your moms, your uncles, moms, dads that were coming to the center. And what was accomplished? The families were treated to a variety of events, because one of the things I know as CREC leaders and for those of us who knew what was happening on the island, the long lines, 15 hours of waiting for gas or to go to get $20 for the ATM. I mean, we just had a storm, and you know, when we had the storms, 3 days without power, we were freaking out. Yeah, it just doesn't comprehend for me. So we made sure that as soon as the families came here to the center, we provided as much as we could. With the help of City Council, well, the least we had a fundraiser trying to raise, because we knew we needed money, and nobody was offering it right away, but we needed to do what we could. We asked our bus companies to donate a bus, and we took them to Holiday Fantasia. You know, our goal was like that we were a welcoming city, welcoming state. So if you want to stay here in Connecticut, I'm going to show you the good things we have so you can say, sí, aquí estoy, me voy a quedar. Because there are plenty of people who are staying. 3 Kings Day celebration, and then we had our closing ceremony, which was probably the saddest day of my life. And again, what was accomplished? In our database, we had 380 volunteers that came through. I have to say, I think it's a way more than that, because we would have people come to the center. I'm here, I have a few hours, what do you need? And I never turned anyone away, never. There was plenty to do there. We collected over 21 tons of food with donations from churches, private donations, and then Food Share, bringing us deliveries every other week. And that's how the money was broken up. It was a little over 60,000, and people still want to give us, but we make sure we share the wealth. We're sending them to the San Juan Center, Catholic Charities, Salvation Army, United Way, you name it. So this slide took me a long time to write, because I'm representing CREC and I want to make sure I have a job tomorrow. So, because the people who know me well know that I'm very vocal, I'm very assertive. I used to say troublemaker, but I'm assertive. And I'm a little, spicy with my language, but that, you know, I got it from my mother, me mommy. One big thing, risks are worth taking. We knew that at CREC, there's a reputation around that CREC has a lot of money, or CREC is everywhere, they're trying to take over. No, we knew that that's something we deal with every day. But we were willing to take the risk to say, we have a building, we've already paid for it, it's sitting there empty. We have Wi-Fi, we have computers, we have desks. Oh, and by the way, we'll give you staff to kind of manage this stuff. We just need you to come and provide the services in one place. Pretty much that was it. And you know, we had some back and forth from folks, and I'm sure the hallway conversations were very vibrant after our meetings, but the other thing was the power in collaboration only works if you really, really invest in collective impact. If you're not willing to give something up and stop saying, what's in it for me, it's not going to work. It's not. And, you know, we had conversations with folks who did just that. Oh, well, what do we get out of it? Well, you know, well, really, I don't know what else to give you when we're not making any money on this. We're not getting any money. We're here because we want these families to come in this door and get what they need and feel welcomed and not have to wait in lines or get told to go here and there 4 or 5 times when they don't have any transportation. It was that simple. What did we learn? Well, lack of communications amongst various systems. And I'm not saying that the systems are not working, because everybody has systems, because that's what works for them. But what we realized is that what was working for you and what was working for you was not talking to each other. And so we found ourselves like in meetings, I'm like, wait a minute, we've already done this. Can we move to the next step? And it's still happening, right? So that's one thing that we learned, and don't have a solution for that, but I'm willing to be the convener of that discussion. I know there's plenty of us in the room that want to get that fixed, so hopefully, God, this never happens again. Big thing, importance of grassroots navigators. Many of us in this room, I've learned from you all. People like Maria Sanchez, Juan Fuentes. I have many people in this room that I look up to every day. We have to get back to that grassroots advocacy, like in your face. And I'm not saying, yeah, you're going to upset some people, we know that. But do it with a collegial, professional way with, say, this is what I want to create. How can you help me? I don't know why we've gotten so far from that, but that's one of the things that I've learned, the importance of grassroots navigators. I will listen to my volunteers because I don't have all the answers, and neither do all of you, but together we can, right? And the biggest thing for me that I still see every day, and I have to say that my family has doubled in size because of this relief center and because of what happened. So it's the emergence of community. We've birthed an emergent community. I mean, we have, because I could pick up the phone and kind of tell people, listen, we have this situation. Tell me what's the best way to do this, or what do I need to do? And that has brought me to where I am today. Because if you're not, I'm not afraid to pick up the phone and ask, right? And that's what we have to do. What still needs to be done? The implementation of a model. Like Dr. Charles says, why wasn't the stuff that happened in Katrina, the model there, implemented here? So, okay, we're past that. Didn't happen, but we still need a model, because guess what? We're still in crisis. We're still in crisis. There's people still coming. And I know some people left to Puerto Rico, but I'm going to tell you, some came back because they called us. Right, Lily? They have called us. They're coming back. Okay. And then lots of learning around bilingual and bicultural, right? Because we can have Spanish-speaking staff all you want. But if you don't understand the culture that you're serving, what good is it that you speak the language? I mean, really. And my last point, which I'm sure will come up in the Q&A, is, yay, we have money now. There's money. There's a list of money somewhere. But the question is, and I'm asking all the brave people in the room to keep asking the question, for what is the money being used, right? Who has access to the money? Who can I call, or who can I send my families? How do the families access that money? Because I have to tell you, I've seen a list, and it's not that clear to me. And I think I can navigate stuff pretty well. But the list of who got the money, I, for one, question, because those people were not around the table from day one. But they have money now. So it's good to, we need resources, I agree. The schools need it. We've got Hispanic agencies that need help, who are helping. So if anything you leave here with today is ask. We're talking about giving, right? We love to give. I, for one, have learned from now on, you want my $20 or my $50, I want to know what you're using it for. I want to know where it's going. I want to know how the families are accessing, and what are the limitations or the parameters that you're putting around the families. Because if you're going to have the families go to you to get a bus pass, and you're going to make them fill out a 5-page survey, really? Or have them come to 5 events so they can get a bus card? That's not what our families need in any situation. And this is not just for the Hurricane Maria, the Caribbean. This is in any emergency situation, really? Sorry, just so. So that's my presentation, okay?
Thank you, Aura. And next, we're going to hear from Councilwoman Wildalis Bermudez. Wildalis.
All right, buenas noches. How's everyone doing? Really great presentations, and support 110% everything that's already been said. For those of you who don't know me, my name is Wildalis Bermudez. I'm on the Hartford City Council, and I'm the minority leader for the Working Families Party. And I'll be talking a little bit more about the stories behind the numbers. So I'm going to also review what happened, what still needs to be done, and within the context of funding, what can we do? So we know that Hurricane Maria was the worst hurricane that has ravaged the island of Puerto Rico. It was a Category 5, 175-mile-per-hour winds. And, you know, according to the recent studies from Harvard study, nearly 5,000 people died as a result of negligence that occurred in the aftermath of the hurricane. It is the death toll that was twice the amount of Hurricane Katrina. And so with that, Connecticut became the place where we received one of the largest amounts, when we're talking about the New England area, of Puerto Rican families that came from Puerto Rico. Some might say, well, why is that? Why Connecticut? Well, we have to remember, right, that in Connecticut, if we look at the New England region per capita, we already have a lot of Puerto Rican families who live here. And so certainly by virtue of that connection of families, of having loved ones here, or friends, or maybe knowing someone that's in Connecticut, we've received a lot of individuals and families. And so we're very thankful for groups like CREC, who opened their doors in November, and immediately upon opening their doors, as Aura Alvarado mentioned, they were swamped. And so another part that happened with all of this is that FEMA placed families in hotels. They placed families in hotels who were eligible for TSA vouchers, temporary assistance, shelter assistance vouchers. And so their families who are there temporarily, in Hartford, this was 3 participating hotels. One of the hotels that received a lot of press, which is the one where many of the families were housed, was the Red Roof Inn. The families within our group that we worked with, there were 2 tracks. There were the families staying in the hotels with TSAs, and then there were the families who were staying with loved ones or with friends or with conocidos de conocidos. And so within our office, we were able to work directly with the families in the hotels. Why this population? This population because it was the population that had the most immediate need. This is the population that literally didn't know from day to day whether or not they would be able to continue living in the hotels because of negligence from FEMA, intentional. The families were given month-to-month extensions, sometimes week-to-week extensions, but in the news we saw, oh, extension is only going to be until January 14th, that's the cutoff for those who are with TSA and staying in the hotels. Oh, another extension for February 14th. Oh, another one for March. So one could only imagine the anxiety of literally being homeless after facing such a natural disaster, after losing everything that you had in your home, and being homeless yet again. So the notion of this invisible homelessness, it's a real thing, and it's happening right in front of our eyes. Some folks say, why do you care so much, Wilalis? So I was born in Yabucoa, Puerto Rico. My parents came here when I was just a little baby. They came to Hartford. And Yabucoa, as you all know, was the place, the town where the hurricane first landed. And it had catastrophic impacts on the island. I still have the majority of my relatives who live in Puerto Rico. We all do, right? So many of us know, even if we don't have relatives, we know of people, we have loved ones, we know of someone who knows someone who is in Puerto Rico. For me specifically, my relatives, my immediate family is still in Puerto Rico. And when the hurricane hit, like many of you in this room, we didn't know if our relatives were alive or if they were dead. So here I was, shortly after the hurricane hit. All of us were faced with this problem. What are we going to do? How can we help? My baby was a newborn, and strapped onto my shoulder, I said, okay, vamos adelante, mi gente. So we, again, really focused on the families in the hotels. And with every passing week, we saw the need that they had. The immediate needs, of course, of housing, of a stable environment. A lot of the children who were there, the majority of the families have young kids, and so there wasn't enough room for them to play in the hotel. There were no kitchens in the hotels. And in some cases, the growing number of families that kept arriving to the hotel because some of the relatives were kicking them out. And so now they had to stay with someone that they knew in the hotel. So rooms that would be typically for 2 people per room quickly morphed, right? And so they had more individuals staying per room because that's what they needed to do in order to survive. At the government level, of course, we condemned FEMA's actions. Governor Malloy immediately called for FEMA to reverse the decision of cutting off temporary housing for Puerto Rican families, as well as Mayor Bronin. And we were very vigilant about making sure that a strong message was sent at the federal level. But that wasn't enough. And it's not enough when you have just, let's say, different individuals in the community, whether it's the governor or the mayor. The real focus and the real work would not have been possible had it not been for amazing volunteers, and we call them the angels. Volunteers stepped in to fill the gaps with pretty much limited resources. When Aura mentioned in her presentation, we have to account for the work that is done on the ground, the work that is done day in, day out in advocacy. It is because of the volunteers. Volunteers like Lily Herrera, who's right here today. You can say hello, Lily. Volunteers like Attorney Dressler, Jeffrey Dressler, and the JCRC. So much community building and childcare, and so much help that was done through Los Amigos. They provided several events for the families, advocacy from Jeanette Hernandez, Ilia Castro, data collection and profile collection from folks like Josh Mictum and Constanza, moving assistance from Project Housewarming, Carrie Firestone. So just to give you a little background on some of these names, and there are many others who were helping in the front line, meeting with the families day in, day out. Lily, she saw that there was this gap. The families had nowhere to cook. They were staying in hotels. And she said, I'm gonna cook from my house. And that's what she started doing for months until the space opened up and they were able to use a kitchen in one of the churches. And then from that, it moved on to actually having food donations. Also, we wanna thank Sama, because they also provided a lot of the food that Lily cooked with other volunteers. There are so many different moving pieces to this, but the work on the ground continues. The work that was done at Red Roof Inn Hotel and other hotels, it's a really great example of what can be done when various people step up to the plate. There's still much more that needs to be done. And so we recognize that the gaps that exist right now, for many of the families who've transitioned out of the hotels, they're now in their own apartments. Many of the families have young children, and there are educational gaps that exist. Because as Dr. Leslie Torres Rodriguez mentioned in her presentation, after receiving 450 new students into the public school system in Hartford, they received these students with open arms, welcoming hands, and they had to fill that gap immediately, hiring new tutors. We recognize that at the federal level, there are funds that are going to be coming in for public schools like Hartford and others throughout the state of Connecticut. But let's be realistic, folks. The money is not here right now. It will happen for the next school year. And let's be realistic, because summer is right around the corner. And so these students need additional resources right now. At the city level, we were unable to provide them with additional resources, and the Hartford public school system has been flat funded for many years. At the city level, in a place like Hartford, we all know that we're currently under the MARB legislation, Municipal Accountability Review Board. And we were very close to potentially having to file for bankruptcy. We did not go that route. So as a city, we are in this situation where we want to do more. We recognize that we have to do more for our students. And we cannot forget about this new group of students that has arrived. Providing ESOL, ELL summer classes, long-term bilingual education is another thought that is very important to consider. What still needs to be done, and again, while many of the families are now transitioned into their own apartments, there is still not a wraparound services for the families and for the elderly. There are volunteers who have taken it upon themselves, some who are sitting here today, like Lily, who are meeting with the families still, and who are advocating for them and who are helping them navigate the system. If we think back about what an ideal wraparound services could look like, let's think back at when the Affordable Care Act was initially rolled out. We can all remember there were various Navigator assisters that were set up in various regions throughout Connecticut. People who were bilingual, in many cases bicultural, who were competent, who understood what the community's needs were. And so at this particular moment, while there are amazing agencies that have stepped up, like Catholic Charities, Salvation Army, also CREC, who's been amazing, CRT, who's helping out with the Franciscan Center with some of the families who are now staying there. These agencies have stepped up, but the reality is, and many others, San Juan Center, and if I forget to mention others, thank you for all that you've done. The reality is that these agencies need more funding. Those caseworkers are doing, the ones that they already have on board, are doing the work on top of already being overextended. They already have heavy caseloads. It's not to say that they're not doing a great job, but it's to say, let's be realistic. How many individuals can caseworkers assist with when they already have a very heavy caseload? Are we introducing new caseworkers that are specifically assigned to help with the displaced families? That's a very important question to answer. We have to be very consistent in terms of having the best opportunities for these families to really make it through. And having that wraparound service and advocacy is extremely important, because for many of the families, they feel as if they're navigating and they're being told to go here, to go there, and there needs to be a better communication and a more streamlined approach, more funding. Currently, as you all know, there's no central location to find support for the families and to build that bigger sense of community. The Relief Center, the CREC Relief Center, was an amazing place, and it closed its doors, unfortunately, on March 14th. It had to close its doors because their lease was up. They could no longer stay in that building. The CREC Relief Center asked the question to the community, is there another place, is there another location that we can use? That question is still out there. There's still a lot of potential to answer that question. What can we do right now? Absolutely create a central location for information, because in the same way that Dr. Charles Venator has been compiling these surveys of the families, if we had a central location, such as the CREC Relief Center, we can call it whatever, any other relief center, then it would be one place where we could have that information stored and also follow up with the families. The implementation of a Navigator model is extremely important so that we can make sure that there is a wraparound service, so that the families don't feel that they're just kind of going blindly through different agencies. Because there are agencies that are out there. Providing programming for students is crucial. This is low-hanging fruit that we need to have our pulse on. There are funds, as we had mentioned before, at the federal government level, but the summertime, there's a gap, and we need to fill it immediately. In a place like Hartford, if we look at the entire region, if this hasn't been said before, in a place like Hartford, if we look at the entire region of Connecticut, we have the highest number of enrolled students from Puerto Rico who've come here to Hartford. In the presentation, it was mentioned 450 students have arrived. We have 371 students who are still with us. Let's be mindful of the fact that 250 schools close in Puerto Rico. So right here in Hartford, we have the highest enrollment of students. There are partners that are willing to work with the Hartford Public School System, and a lot of collaboration that can occur, but money this summer will go a long way for these students. Another important component in all of this is accountability. Accountability to all participating partners. The government level, yes, the local level as well, local, state, and federal. It was mentioned earlier that $1.5 million, and I want to again stress it was million, not billion, million. $1.5 million was approved by Governor Malloy. Of that amount, of the $1.5 million, $90,000 specifically were earmarked for Hartford, 2 participating agencies. And so, what will those 2 participating agencies bring to the table? What can others bring to the table? Is there room for collaboration? $90,000, however, is still not enough, because when we look at what we can do, what needs to be done, we also need to focus on the issue of housing, which has been mentioned before. And so, we need to have a better communication between the different levels of government and the agencies. There needs to be, for those who didn't know, on June 18th, there's going to be a deadline from FEMA for families and individuals to register with FEMA. If they don't register with FEMA upon coming here to Connecticut, they will not be eligible, potentially eligible for rental assistance or disaster housing assistance, known as DHAP. DHAP was offered in Texas. It is not being offered right now. And that's something that we need. There needs to be an interagency agreement from HUD and the state, but overall, this is a humanitarian effort. We need to help those who have arrived. Some have asked, why, when there's so many other needs that we need to fill? And I've been waiting here all along for housing, but this is a humanitarian effort. If we could do it in Texas, we can do it here. And this is a crucial moment and defining moment for all of us, especially for Latinos. Much more needs to be done to shine the light, and the space to do it is right here and right now with all of you. Thank you.
Thank you. I want you all to join me in giving a round of applause to our panelists. Thank you very much. We are so fortunate to have examples here with us tonight of the kind of work that was done, that is still being done in the community for the families who are here, who received the folks who came in, and the folks who became new members of our community. So I heard a few things, and I want to be able to summarize it for all of you, because what I want to do is get us to start thinking about how we can utilize this to be able to take this information to move it forward in your own community, in your own place. As I mentioned to you, as a staff at the Hartford Foundation, we are looking at this. We're utilizing this to be able to get us to think about what our next steps are. But so a couple things that I heard is that this really for us was like a perfect storm, because this happened at a time when the city of Hartford and the state of Connecticut was facing unprecedented dire financial situations. What I also heard, and I think Charles gave us the data, and I think eventually we will see the data really come to life, and the other panelists as well, is that a lot of the issues that were coming up are issues that we know that we have been battling in our communities for a long time. So economic security, economic development, job opportunities, housing, healthcare, the need to really fund and take care of food insecurities. All of these pieces are things that we know for a long time have impacted the Latino community in the greater Hartford region, and just were brought to light more as a result of the influx of the individuals who came to stay with us. But what I also did hear was, and I believe Leslie mentioned it, is that we are a community that really does care. And what I learned as well is what we all knew anecdotally. Sure, the nonprofits are shouldering that burden, and that was really, and that continues to be the case. But also the burden was taken on by, at least you call them angels, and I think of them as good Samaritans, as those folks who live by civic engagement, live it every day, don't just talk about what it means to be a part of a community and be a good neighbor. So I want to take this opportunity to let you all to start thinking about what your questions will be, to the end of making this more of a learning opportunity for all of us. And I wanted to open up the questions, and again, I hope you've written your stuff down, and I wanted to take the opportunity as moderator to pose a question to the panel, and then I will open it up to all of you. And that is that now that we have an opportunity to reflect, and oftentimes when you're in a crisis mode, you cannot reflect, and so we've sort of been given this blessing of a little bit of time to think about it. I ask all of you, what would you do differently? So now that you've seen what has happened, you were involved, can you tell us about one thing that you would do differently? And each one of you, Charles, you have a mic right there. I think we can just figure out how to turn it on. There's another one over there. If I can get my colleagues to maybe perhaps help, Isaiah, if you can help Charles. Yeah, and you can lift it out of the, yeah.
Quick response. I think the comment that Councilwoman Bermudez raised about collecting information right away is crucial. We need some sort of repository to find out what's going on. Also, one of the things that I would do differently is I would start by figuring out what exactly is the coordinated response or lack thereof. Because one of the things that took me a while to figure out as I'm asking questions is who's managing what, who's accountable for what agreement authorizes what. And I say this because my spouse does a lot of contracting work for HUD and NEH and worked in Katrina and Sandy. And she kept asking me questions and I didn't know how to answer these questions. Is there an interagency agreement between FEMA and HUD to deal with this? And I'm in this committee and that committee. So I want to make sure, I want to echo the comment that Councilwoman Bermudez raised. We need to have some sort of strategic, coordinated response that collects information, not just at a governor's level, but also at a community level with partners that are not necessarily attending the governor's meeting. And again, this is not to criticize what the governor has done, but it's to say we need more information across the board.
I absolutely agree with that. More information across the board and translating the information so that the people on the ground, the displaced families and individuals, receive it in a way that makes sense, so that it's not very top-heavy. And I'm not just saying translate it. If you could translate something to Spanish, yes, you can translate into Spanish and it could be very academic. But if I go to XYZ agency? What are the additional steps that I need to take, or what else can be offered for me? And so the same way of having better communication and seeing, okay, what agency offers this and what agency offers that, that's also holds true for the residents that are now here. And so having that translated in a way that makes a map for them. And then the second thing would be absolutely making sure that at the head of the table are the volunteers on the ground and the families themselves, because their voice is extremely important. They hold a lot of information, they are living it day in and day out, and they have to be accounted in those policy meetings and the high-level meetings and decisions that are being made.
Wow, that's a hard question. Two things I guess for me personally, and I would say maybe I'm going to speak for CREC, because I think I would have liked that we fought harder to keep the relief center open by taking advantage of the people who were coming to us on a daily basis and saying, how can we help you? But we were moving so fast and we were taking care of everybody who walked in that door that I think what we should have done is, serve the families, but get the agencies who stepped up and the volunteers who were presente and say, okay, we need to do more. How can we make this model viable for future things? So that's the two things that I think I would have slowed down a little bit and taken advantage of all those angels that were coming with great ideas, but we were moving so fast that we lost a little bit of that. But we can get it back.
I think for us, it's more of a practical need that we still have, which is around the recruitment for the adults and just staffing needs that we have. We immediately wanted to just program for the students, right? Make sure that not only they had the right programming, but that we were able to support their psychological needs as well. And so it almost got lost for us that, okay, they're coming, they're enrolling in larger numbers, and we're going to run out of certified staff to service our students. And so and this is something that we're working with the State Department of Education around, and so there's still a gap there for us. And while we're trying to be proactive in reaching out to the universities in Puerto Rico and other areas to certify bilingual TESOL teachers, I still don't have the framework to do it in a fast way, because it's a shortage area to begin with, right, throughout the state, throughout the country. And so it's still a challenge for us around the human capital to service our students in a bilingual and bicultural way.
Great. Thank you. Thank you all for your honest responses. Okay, so now I'm going to open up the floor to questions. I have my colleague Pam, who has a roving microphone, and I'm going to try to see hands immediately. I saw Estela Lopez. Pam, you want to pass it over to Estela? Estela, you want to raise your hand so Pam can see where you are? Yeah. And here's what I would say to all of us. We have probably about 20 minutes before 8 o'clock. I'd like to be respectful of your time, of the work that you do every day. So if we can keep our questions as short and concise as possible, so that we can try to get an opportunity to have everybody respond.
Thank you. And so I'll speak very few words. I just want to thank all of you, and especially Aura, because we were all thinking, what can we do? How do we help our people? And by having a place where I could go personally and help, it helped me. It really helped me. So I just wanted to publicly thank you for creating that welcoming center. I want to focus on what Charles presented, the data about low-income and very low-income people, because I think we have a population here that is very vulnerable. And those are the ones still in the hotels, probably. Those are the ones that need health care. Those are the ones that don't need housing. And those are the ones that if they have stayed in Puerto Rico, they probably would have died. Because a lot of the people that die, we know, were the elderly, the low income, the sick, the vulnerable people. And that's what is reflected here. You have about 82%.
let me clarify, because this is a really important issue. We were asked to look at the impact of Puerto Rican migration on households in Connecticut. So we did go to the hotel, Red Roof Inn, and we did talk to migrants who were displaced, but this reflects data on households that live here. Not in addition to, I mean, what we found is that the needs of people who are being displaced are fairly similar to the needs of people who already live here. So I want to clarify that also, that you're right in that. But this reflects also the greater needs of people who are living here and have been living here, who are receiving people. Does that make sense?
Talking about not only the ones that are coming, but also the ones that are
Here. See, yeah, we wanted to get an impact on the households.
I'll be right back.
Oh, yes.
Then the question is, how...
Estela, hold on one second. Let me just get Pam to give that microphone over to you.
Okay, I just want to, how do we help? And here's the thing, I don't want world peace. I want what I read. I want 2 or 3 things that can be done collaboratively, that we can do to make a difference, that.
Does anybody want to take that additional piece on? Okay. All right.
Well, no, I mean, I totally agree, and thank you for that. Yeah, the center was, and I think we still have places we can go help. So yeah, it was just, it's what we can do here, because we couldn't all go on a plane and go help in Puerto Rico. So yes, that's what the center was, but I'm with you. Of course, I pray for world peace all the time, but I think if we have 3 goals, and we get around the table and we say, okay, put your egos aside, forget about what's in it, how much you're going to get in your pocket or whatever, and forget about the podium time you're going to get, because that's another thing that we're so good for here in Connecticut. Just get down to the nitty-gritty. What is the problems? Between the smart people in the room, figure it out, and then get the other folks involved and get it done. And then, boom. Now we have a model and we keep going. I'm still asking for a model. There's no model. No one's come to ask us for a model. No one's come to CREC at all, not even once, to come and say, wow, yes, we're getting accolades left and right. Oh, CREC did this, but not one person came to us and say, wow, how can we keep this open, or how can we replicate this? Can we use what you've already done? Can we make it a little better? And that's the thing that kind of, when we closed the center, thank goodness for Joel and Catholic Charities, because that made us a little, less hesitant, we were a little more, we had comfort saying that we have some good people to talk to and others around. But I just wish that there were more brave people around the table that could have said, you know what? Let's put egos aside or whatever you think, because they thought we wanted the money. We never wanted the money. It was not about the money. I, for one, I was devastated. We could not go to Arecibo. We didn't talk to our families for weeks. So we what can we do here, right? We sent money to Puerto Rico. We did that. So it's going back to that, right? So sorry, it took a little longer.
Thank you. Yes, Tony.
I have 2 questions. One is for Dr. Leslie, and one for Dr. Charles. Leslie, what was the behavioral state of the kids that came to the system, given the dramatic impact, and how did you deal with that? And for Dr. Charles, if I understand your data correctly, I'm assuming that most of the folks that migrated were of low social economic status. And if that's the case, then is there any way to make any correlation with the data that you have developed to the financial impact that the city of Hartford would need to make in order to bring those folks up to, a level where they could at least have a basis to grow?
So I'll answer first. So it showed up differently for many of our students. As we all know, trauma shows up very differently for different people depending on developmental stages. And some of our students did not want to engage in dialogue, right? Our support staff, our social workers, our clinicians, our community-based providers that do provide the wraparound supports for our students tried to engage, and many did. Many of our students were part of psychosocial groups that were created to meet the needs. But it was the adults adults. It was the families who we found needed desperately to have a humanistic connection with our staff, and there were many, many tears that were shared in those offices, which is why we had to then extend, right, the connections to our community-based providers, because it meant that while we had the supports and the structure for the students, it's the adults that our students were going home to every single day. And then that, we noticed, would trigger students, right, the children, as the days and the weeks progressed. And so it became a larger approach to providing the psychosocial needs.
Let me qualify a little bit. Yes, the majority of people that we interviewed were living in poverty, or are in poverty because they lost everything, and they're living in shelters, or, well, in some cases in shelters. Some shelters are over capacity. But we were looking at households here primarily. So this is a problem of Puerto Ricans who are living here. And they're telling us in the survey, and I'm just going to focus on the survey because I have personal opinions about the bigger picture. But in the survey, they tell us we need housing, we got to find more space to live in, or we need housing, just period housing. We need more money because even if we're working, we don't make enough money to eat, to fill the table. And we need more employment opportunities. Not just working in Walmart or working in a service sector around the bus. We just need employment that's going to give us the ability. Now, one of the things that we started teasing out, and I did not do this in this presentation, is that if you leave Hartford, a lot of folks who are leaving the Hartford city that are employed, but they're just not making enough money. So whereas we saw a lot of unemployment in the city of Hartford, in the surrounding towns, Manchester, East Hartford, et cetera, people are working, they're just not making enough money to put food on the table for the whole family. So we got to address the question of housing, food, and adequate employment based on what we're finding in the survey.
Thank you, Charles. Okay, tenemos la señorita Ashlyn de Puerto Rico. ¿Tienes una pregunta? We have Ashlyn who's here with her family from Puerto Rico, and I believe they have a question or a comment.
Mala. Ashleen and her husband, Emmanuel, are staying at the St. Patrick's St. Anthony's Church, who has been so kind to us, so they go to everything with us to make sure we are doing our job. Ashleen's question is, ¿qué están haciendo para ayudar directamente o indirectamente a estas personas que vinieron de Puerto Rico en cuanto a su salud mental? All of the panel speaks Spanish, so I think you guys can translate that as well.
Here's what I'd like you to do, if you could translate that into English, because we have other folks here that may not have that, and it's an important question.
Okay. Ashleen's question is, what are you doing to help directly or indirectly for people who came from Puerto Rico and who have mental health needs?
So, one of the things that we encountered, and lo voy a decir en español también. One of the things that we encountered working with the families in the hotel is, yes, that is a need, and the PTSD, the kids suffering PTSD, this is a pretty life-changing traumatic event. Not to mention other health conditions that the families had. But looking at that microcosm of the families in the hotel, there were several instances where there needed to be more intervention. And I can sit here and say that there could have been more response, a faster response and more trained clinician support that could have been offered. And so that was at the hotel where we had direct access to the families. Now, mind you, there are many others who are living now on their own or with other individuals. I'll share with you a story of a little boy who's 8 years old, and speaking on the medical part of it. It took that little boy who had epilepsy almost 4 months for him to get his actual Husky card, even though he was eligible right from the beginning. And all it took was just a simple email to follow up with DSS to make sure that he had it, even though he had been to DSS many times. So, mi punto es que necesitamos hacer más, porque miramos el microcosmo de lo que es, ¿verdad?, las personas que se estaban quedando en el hotel, y los recursos debían de ser más recursos para las familias. Los recursos existen, pero cómo poder navegar ese sistema es algo que todavía se necesita, y se necesita urgentemente.
Anybody else want to take that on? Okay, all right. Okay, I've got Renan, State Representative Vargas, and Yvette Melendez. Renan.
Sure. So, hi everyone, and fantastic job. I mean, this is absolutely fascinating. So I have three things. One, thank you for just highlighting the importance of this topic. This is just interesting to really get underneath and understand the real situation and how it is really impacting the Hartford area. I am Boricua 100%. I was born and raised in the island and came here about a decade ago. So I have personal connection to Puerto Rico. So two questions. One is, obviously the situation is not getting any better, right? And we know that this is going to most likely continue for the upcoming months, and God knows, could be a couple of years. So do we know, or do we have, or are we working on having some sort of center or some sort of contact for those families that are coming from the island, that we can redirect them to a specific place where they can get information about housing or jobs, or, you know, more further education, if you will. And then the second question is, do we know of any other models? Think about Florida as a way of example, where they have a lot of migration as well, right, from other countries altogether. So what are they doing, and what have they done over there? And is that something that we could explore to see how we can implement something similar here?
Well, those are hard questions. You know, there's a lot of smart people in the audience. So yes, there's talks of another center with several people. However, it's just, you know, because I just wanted to clarify before, because, how do I say this? Ay, Dios mío. Okay. No, so here's the thing. The Grassroots Navigators, and Ashleen y Manuel, I love you, los quiero mucho, y de mi corazón le voy a dar la, ¿cómo se dice apology? Te voy a darle disculpa, because the story that Will Delis said is that's one of hundreds. And what I'm about to say is I'm not discrediting any agency. What I'm saying is that, listen, I'm a firm believer of policies. My dad was military, and he had the belt y la chancleta. So we have policy at home, right? But what there was, and I think there is in all of our Puerto Rican culture, that there's ways to get things done. So when you go to DSS, not once, not twice, not 3 times, how about 6 times? And you wait 3 or 4 hours to be told to come back because somebody's at lunch. And all you needed was a signature, by the way. That's all you were waiting for, 4 times, 6 times. And that keeps happening over and over. And I'm just saying, and so how we handled that was that we met with the commissioner, and we went to DMV. And I didn't ask to jump the line, because that was the first question. Oh, you want everybody to come in front of the people that are waiting, number 600 and whatever. I said, no, that's not what I want. What I want is a liaison or a navigator that will, because I will meet with them, tell me explain to me, because you know, you can go on the DMV website all you want. I still don't get some of the stuff on there, and I have a degree, okay? But, so that's what we wanted, and that's what we got. In some cases, we got it right away. DMV, I have to tell you, that commissioner and Millie over there, we took 3 van loads, 10, 20 people sometimes, 6 people, and it was just that. I would go in a room, everybody had their forms, and you sit down, okay, oh, no, you're missing one thing, you're gonna have to come on the next trip. Okay, wait here until we take you back. And that's how it was. But we weren't so lucky with some other departments. We kept asking, where's our navigator? I think we're still asking, where's our liaison? It's getting better, but it shouldn't have taken this long. It should not have. That little boy should have had his medicine. And there's many cases like that. So to that question, but yes, I would be happy to provide some little model, because we learned as we went along. We did not have all the answers. We still don't. But if somebody has space out there, trust me, 3, 4 phone calls, we'll get you food, we'll get you clothes. Well, I would tell you, don't get clothes. That was a nightmare. But we can get bus cards, we can get gift cards to Walmart. We just gave Home Depot cards to somebody who's an electrician, who somebody gave him an opportunity. He doesn't have his license, but they said, if you get some tools, I'll give you work. Guess what we did? We took him to Home Depot, pick out your tools, get to work. It's that simple. Not like, let's fill out a 100-page questionnaire as to why you need a Home Depot card. Really? So, but yes, there's a lot of people who said, why is the center closing? But it was the grassroots volunteer. It was the volunteers. It wasn't the powers that be. I couldn't go to my boss and say, let's keep the center open. They were like, no, we don't. We need the big people in the room to say, we need to do it together, because we couldn't keep investing. We didn't have money. We don't have money. So that's how it is. So yes, is there talk of a center? Yes, but it has to be, again, collective impact. It cannot be one person or two. It has got to be like all of us together and say, what does this center need? And we're not taking away from people. Why don't you come for a few hours and give your services to us? That's what we did at the center. It was temporary. Catholic Charities didn't ask for a thing. They sent 2 staff people 3 days a week to sit there and to do what they do every day, because they're the ones who do it. I don't know how to do that. They did it well. We just gave him a space. We gave him a phone. We gave him Wi-Fi. I had coffee for his staff. They signed in. I took the kid, that's how it goes. They did the work. And that's how it started happening. So if we can get a center like that open, count me in.
Thank you. All right, so I'm just going to do a point of process and order. It is now 8 o'clock, so I'm going to, well, here's what I'm going to tell you. I am willing to extend this for probably 10 more minutes, and those of you, I want to be respectful, who have the opportunity to stay, I invite you to stay. If you have to leave, we understand that. What I also would tell you is, if you'd like to leave your questions, if I don't get to you, leave your questions on the table, or make sure you bring them back to me. Can I have a show of hands of who, my colleague? I know I have Yvette Bello, I have Megan Burke, I have Liana Garcia-Fresher, so I have Scott Gall, Chris Senecal from the Hartford Foundation. So if I don't get to you, please make sure you see us and give us your question, because what we will commit to do is to put the questions up in the information and to have that, and to have some amount of response. Okay, State Representative Vargas and Yvette Melendez, and what I will tell to my folks who are waiting is let's condense the questions. Okay, great.
Well, first of all, I want to thank the Latino Endowment Fund and the Foundation for sponsoring this forum, and all the people who worked so hard during this whole crisis, and all the organizations that stepped up. And what became clear to me during this whole discussion is that we have systems set up in Connecticut to make sure that people wait for services. And that includes long-term Connecticut residents that are still waiting on lists for services. And it's a poor community helping the poor. And so it was, to me, it's obvious it's a people-to-people effort that's really working, the people-to-people effort. My question was for the superintendent. I heard that the State Department of Education was going to try to make sure that they gave out temporary certificates so that people could work in the system, and you'd be able to hire people without meeting all the criteria.
True, and we have 3 of them, except we need to find more, right? So it's finding the individuals now to come in and work. So absolutely, work with SDE from the very beginning to help facilitate that process, but it's now recruiting. The tutors were fast, right, because we were able to identify 17 retirees that immediately were on board, but it's the full-time certified staff.
Can I add, if I
Yeah,
may?
in the microphone, Charles, it'd just be easier for the...
I've been holding back. Based on census data, between 2013 and 2016, Connecticut received 359 students from Puerto Rico. Just in the 6 months where, after the hurricane, Connecticut received 1,827 students. That's almost quintupled. I mean, I had an opportunity to work in one of the schools, and they're doing an amazing job. The village is doing an amazing, but this is a quintupling amount of students in Connecticut and Hartford, with not much money to
No,
respond.
don't go there. No, we
Get her
yeah.
started.
Very limited resources. Great, thank you. Back.
Right here.
Yeah, go. Got it.
I'll be very brief. You've highlighted a couple of key points, which most of us heard repeated. One was the lack of a model that would be replicated, not just in Hartford, but statewide. We focus on Hartford because this is the Hartford Foundation for Public Giving. Thank you, Foundation. We know what we've talked about today has happened in Waterbury, New Haven, Bridgeport, New London, and that's just Connecticut. So this problem is exacerbated throughout many states. So the model is one that is not going to be a unique model. It's a model that should work for other cities and towns where we have large numbers of Puerto Ricans. The other is, we've talked about the failure of our systems to work. Now, let's be honest. Our system didn't work before the crisis in terms of a coordinated approach among human services agencies. The waiting lists have been there forever, and with a state in crisis, a city in fiscal crisis, talk about compounding. We have compounded beyond any kind of economic model with this very crisis that took place. But to make it worse, if we could even think of it being any worse, we know Alberto happened last week. That was the first of the hurricanes. We are in hurricane season. We've talked about not having a planning system, a planning model. We've appropriated $1.5 million that has been earmarked for specific agencies, not a system that would create a collaborative model or a system that would create a model for a one-stop shopping center. So this is a rhetorical question because I know none of us here can answer this, but I'm sitting in fear because we know that the first sign of another serious storm, it doesn't even have to be a Category 1. We're going to see another wave because people are going to be scared out of their minds, the people that are there, plus, people that are still going to come. And what is it that we as a state, from a public policy perspective, and I'm sorry, Edwin, I keep looking at you, from a public policy perspective, what do we do? I mean, beyond the school system, Department of Social Services, Department of Education, Department of Housing, Department of Children and Advocacy, Department of Mental Health Services. So that's it. I'm sorry, I wasn't as brief as I intended.
I appreciate the passion. So, yes, Elba, and then Nelson, and then we're going to have time for one more because it's almost 8:15.
I have a question. I want to answer her question. The Catholic Charity, the Institute Hispanic Family, is doing counseling for mental health. El Catholic Charity, el Instituto de la Familia Hispana, está dando servicio a aquellas personas que necesitan salud mental. So, si saben de alguna, refiéranlo y si hay problema, me llaman. ¿Ok? Pero hay servicio para esas familias. Gracias.
Okay, great. Nelson, did you have a question?
Good evening. Thank you, panelists. Great job. Thank you, the Hartford Foundation, for organizing this forum. It's very important. It's been recently brought to my attention that by calling 211 and people who do that identify themselves as disaster survivors can receive immediate disaster case management services. I think referring back to the June 18th FEMA deadline. Are people being made aware in Connecticut about 211? And if so, how are they being made aware? And finally, are there any numbers on the amount of people who've called 211?
Great.
Thank you.
Thank you, Nelson. We are fortunate to have some agency folks here, and I know Rick Porth is here. Rick, would you like to talk about that really briefly?
Promise. Thank you also to the Hartford Foundation, who helped so generously to fund a lot of the response to this. What I want to say is that so far 211 has fielded almost 5,000 calls from all across the state. Most active area by far is the city of Hartford, but there are other towns in this region, East Hartford, Manchester, West Hartford, that are fairly active as well. Like Councilwoman Bermuda said, the state coordinated response to Hurricane Maria has been focused in particular on households who are in TSA hotel placements. When this started, there were 225 households in hotels across the whole state. Today, there are 93 households, and they're going to lose their eligibility, every single one of them, on July 1st. We spent most of today working with various agencies, including Catholic Charities, Salvation Army, many others, on devising individual plans for those 93 households. We hope that we'll be able to resolve that before July 1st. You asked, I promise I'll stop real quick. You asked a question before, Wanda, what would we do differently? I think we need to focus, I wish we had started sooner. I think we need to focus now on the families that are doubled up and tripled up. And there are strategies, and it's all about housing. Ultimately, it's all about housing. There are strategies, more more beds, different types of furniture, income from public assistance if necessary, doubled up with family members that would allow you to move into a little more expensive apartment with more room, things that could be done, and we're going to need to start to focus on that after the focus moves away from hotel placements. Thanks for the chance to talk about it.
Thank you. Thank you, Rick. Yes, Charles.
Just one quick question. We started conducting the survey after CREC was closing. Actually, we started. And most people are indicating that 211 is their center source. And I want to be clear. I mean, we've heard that consistently in the survey. We also, I want to highlight a point that I raised. 50% of the people, 55% of the people who responded to the survey say they're expecting somebody to come, regardless of whether there's a hurricane or economic crisis. We already know that. We're getting people are coming back, whether it's after the school year or later.
Okay, so I have kept you back. Again, I want to take this opportunity to thank our panelists for joining us. I'd like to also take this opportunity to thank all of you for coming and joining us. A couple of household items. All of the presentations will be placed on the Latino Endowment Fund page on the Hartford Foundation website so that you can utilize it. I know Charles is working diligently to finish up the survey. The Hartford Foundation will put that out. We anticipate that will be done in the next couple of weeks. We anticipate that we will provide other opportunities for that information to get out to all of you. Again, thank you for the opportunity to bring all of you together. I encourage all of you to have conversations while you're here, and I look forward to seeing all of you again when we get back together in the future. Thank you all. Buenas noches.